Now that we have the technology worked out, welcome everyone. I'm Carol Ryan. I'm a faculty member in the School of Public Health Department of Epidemiology and also director of the PIPER program, which stands for Pediatric Injury Prevention Education and Research Program. PIPER and the Department of Epidemiology are co-sponsoring this session today, and I want to welcome all of you. I'm just curious, before we get started, how many of you are students on campus, just to get a sense of the audience? Faculty or on campus? Staff? What about people from the community? Oh, great. I'm glad we have a good mix. Did I miss any categories? Other students, right? Other students. So before I introduce today's speaker, I do want to alert you to our next seminar, which is coming up soon, and I'll pass this around. Hank Weiss from University of Otago in New Zealand will be here. We're capitalizing on the fact he's coming to a conference in Boulder and agreed to come down and give a seminar on September 13th, Friday the 13th, and he'll be talking about bicycling injuries involving car doors. So I'll pass this around, and you can put it on your calendar. Also, we have a sign-up sheet if you want to be and may not be on our mailing list for other seminars. We'll send that around, and we're happy to add you to the mailing list. We try to do an injury seminar at least once a month, and we have some other good ones in the lineup coming up soon. But I'm especially pleased today to be able to introduce Charlie Branas, who's someone I've known for a number of years, and I'm eager to hear him talk about his recent work. Charlie is currently professor of epidemiology and director of the Cartographic modeling lab at the University of Pennsylvania, and he'll talk more about that work. But just to give a little background, he has a master's in emergency services, a PhD from Johns Hopkins from their injury program within health policy and epidemiology focus, and a postdoc from Berkeley. He also has appointments as professor of emergency medicine and professor of surgery, although he's not a surgeon. Don't let him operate on you. And a number of other appointments. He's been on various scientific review boards, NIH, CDC, Canadian Research Council, and the South African Medical Research Council, and is past president of the Society for the Advancement of Violence and Injury Research, SAVR, which, if you don't belong to SAVR, you should. And I'm happy to provide you information about that, and we can help sign you up. But Charlie, great to have you here, and I look forward to hearing about your work.
Thank you very much. I appreciate it. So, thanks for coming out in August. I know I'm very impressed. I don't think we could have pulled a crowd like this for a summer session. So, thanks so much for coming out. This originally began, I was having discussions with Steve Berman, who's in global health. So this was originally, I was going to come here just to talk about global health things and our work in Guatemala and how we might collaborate. But then it turned into a talk, so I'm just very pleased to tell you about our work more broadly, which I'm not going to get into our global work. I want to talk more about our work in cities, and you can stop me at any time to ask me questions, and I hope to leave as much time as possible in the end to get questions, particularly since we have a great mix of community members and academic faculty here. So there's this notion of megacities, yeah? And so there's a map of the world with everything is drawn to scale. I don't remember what projection it is, but there's been an interesting movement. And for those of you who don't know it, in 2008, we had more people globally living in cities than anywhere else. It's the first time in human history. This is a map that is then the polygons or the size of the countries are weighted by the amount of people that are moving into cities in those countries. And you'll note how big India gets, how large China gets. And I don't want to talk about that. I want to talk about how small the United States gets in this map. We are not experiencing a mega city explosion here. We're experiencing the opposite, a shrinking city issue. I had this, I used the word shrinking city at a conference last year, and someone immediately corrected me and said, that's not good language. You must call them legacy cities, otherwise you insult the people in the shrinking cities. So for the future, we'll talk about them as legacy cities, but this is what you get when people leave legacy cities, particularly eastern cities, Rust Belt cities, and I think perhaps here in Denver to some degree there's been a reduction in population. Tell me if that's true or not. No. Okay, so you've had a growing city. So we can talk about this a little bit more. I don't know how fast your growth rate has been in your city center, but 14 of the 15 largest cities in the U.S. actually did lose population from 2000 to 2010. Philadelphia was the one exception. We lost the most population of any city in the 50s, 60s, and 70s, and we managed to reverse that. And I want to talk to you about some of the programs that we've put into place to reverse that, to bring people back into the city, but not just to raise population of the city, to also think about making it a better place to live with higher quality of life, a safer city, and a healthier city. We've been thinking about this from an academic standpoint, not just from Philadelphia's viewpoint, but in general, if we were going to begin to study programs that are really going to make a shift in public health, there were three components that we've been focusing down on. I have a colleague who's an anthropologist who really made me start to think about structural changes. And things that change the basic structures that we interact with on a daily basis, and how those might be altered, particularly structures that form negative health impacts on people. So we've very much looked at environments. So you can, for instance, offer up biobehavioral programs, education and behavior modification programs that are incredibly successful, but on people in sort of academic studies, but once you release folks back into an environment that doesn't support that behavior change, they will revert. So you not only have to have behavior change, you have to couple it with larger structural changes to the surrounding environment that doesn't permit, if it's not changed, will not permit that behavior to improve. So we've been thinking about those structural changes quite a bit and what those might be. We've also been thinking about programs that are scalable. So not only changing the basic structure, but things that can be scaled up. Not one-off programs that can be done for only a select section of a city or a town, and that affect only the people that come through that, but things that could be spread, much more widespread across the entire area. Okay? And then finally, the last thing we've been thinking about quite a bit are sustainable programs. Programs that, again, not only change basic structures, can be moved around, but that are cost-effective. Things that can be done quickly and that will last for long periods of time. And so one of my favorite quotes that was in the American Journal of Public Health a couple of years ago, and this relates to malaria, was that if a brackish tidal pool is breeding mosquitoes, just filling it in may do a lot more and continue to reduce malaria for years to come than expecting the local community members to continue applying larvicide. Now, there are folks who are on a track to get Nobel laureates for their economic work in convincing folks to apply, convincing community members to apply larvicide, for instance, to bed nets and so forth. And that's fine, but there might be other structures, and I'm only offering this as a metaphor.
Just a quick question on your previous slide about cities.
Yeah.
You're talking about metropolitan areas, or are you including suburbs?
No, I'm talking about mainly city centers. Yeah. And so those are our major cities, and we've done a lot of studies of cities and safety, and I would say there are about 30 major cities in the U.S. that are over 1 million people, and in those 15, those 15 are included in that. So the other thing on the right is, I take this back. Does anyone know what this is on the right? What this is a map of? This is our remake of it, which makes it much easier to understand, I think, than what the original map in the 1850s showed. Exactly. So this is John Snow and the pumps. right? And so this is our hotspot map of where the cases of cholera were, and you can see right away that the pump to take the handle off is where the star is. But this, in fact, was a form of what I was talking about in terms of a structural change. It's a basic change to that environment. For the injury prevention people, the analogy here might be you can have behavior modification programs to get people to drive better, or you can consider changing the roadway environment. There might be relative benefits to both of those, but perhaps changing the roadway environment and investing in that might have a longer term change if it's done correctly. And other things that we've been thinking quite a bit about in terms of urban examples that have had some success, the one that people think about quite a bit are smoke-free zones. So that's a basic change in the environment. One of my colleagues at Penn has done a lot of studies, John McDonald, in business improvement districts, and he's also a co-investigator on all the work I'm about to talk to you about. Mixed-use retail, light rail systems in cities like Charlotte have done a lot in terms of improving health, perhaps lowering BMI, getting people out of their cars. Rezoning, we've done a lot of work in terms of points of sale for alcohol, as well as advertising for tobacco has also had quite an impact on certain things like the commission of violence and the consumption of alcohol. And then the bottom two are more recent, what we've been looking into, and others have too. So the first is housing remediation. There's a great program that I always hold up as an example in Seattle, these what are called Breathe Easy homes, which have, there's been a number of studies of them, and these are homes that are completely redone to prevent asthma, particularly childhood asthma rates, and they've been very successful. So again, it's a great example of altering the environment that the child interacts with on a daily basis and having an incredible reduction. Very large reduction in, for instance, their use of medical care for asthma problems. The other one that we've been looking into is this Doors and Windows program in the city of Philadelphia, which I'll talk to for a second, and then I want to get to the last one, which I'll concentrate on. So the Doors and Windows program is a program for abandoned and dilapidated housing in the city of Philadelphia, where instead of redoing the entire building and making it livable, the city will take the broken windows, and the doors and all the graffiti that might be on the front of the building. They will replace them, okay, and they will do, perhaps there are a dozen of these on any given block, and the time to do this is very short. Perhaps in a month all this can be done. And so the visual of that block changes in almost overnight. And we think that that has an impact on residents' quality of life, the way they interact with their spaces, the way they invest in their spaces, and, for instance, informally, for purposes of safety and crime, which Philadelphia has a big issue of, the way they informally police their spaces. So that's one thing we're looking into for housing remediation. But those are that sort of doors and windows treatment. We also have the country's largest mural arts program, which is very fascinating. So we have 2,500 different murals in the city of Philadelphia. In fact, I just got one commissioned right across the street from me. I wish I had a picture up to show you. It's beautiful, from an abandoned house, abandoned building, to a bunch of different colorful butterflies across the building. It really does change your view every time you come out of your home every day. My kids love it. All the kids on the block love it, and so forth. But these are two-dimensional shifts, So they're purely visual. Land remediation, on the other hand, changing abandoned and vacant lots, adding in parks and gardens, are not only visual, can not only be visual, but they're three-dimensional shifts, because then the spaces, you can interact with the spaces, okay? And we think that and it's the reason we've chosen them first to really invest academic and research money into, to take a look at what the impacts of these three-dimensional changes. And I will particularly concentrate on vacant lots. I know I just spoke with Joe Litt, who has proposed some great community gardening work here in Denver, and to look at that using similar methods. But I want to concentrate on vacant lots, and I'll tell you why they're distinct from gardens. Now, in general, abandoned and vacant places, there's this terrible cycle that goes on in shrinking cities, legacy cities. They create a visually unpleasant environment, And if you believe broken windows theory, disorder goes up, people's anonymity goes up, people no longer want to interact with the spaces and with each other, okay? Residents, as I said, become disconnected. Criminals become emboldened. I'll show you a little example of that. Crime goes up, quality of life goes down, health quality goes down, we think. Then residents leave and businesses close, okay? This is a big deal. And the businesses I'm talking about that close, that have the biggest shift here, are anchor businesses. Businesses like supermarkets, yeah, banks, these sorts of businesses that people need on a daily basis, and it would be much easier to access them, not through a car, for instance. If you can walk to them, it's much better. These sorts of businesses, and what happens is, in our study of alcohol outlets, for instance, shows that once these anchor businesses leave, places like alcohol outlets begin to accumulate. Because they fill in the activities of those anchor businesses. They will cash checks, they will sell food. And so these dual use, and oh, by the way, while you're there cashing your check and buying your food for the day, you can also get alcohol, so consumption goes up and there are other issues. But for our purposes, the cycle continues, okay? When residents leave, businesses close, there's more abandoned and vacant places, and it just spirals out of control. And that's what's happened in a lot of cities, Philadelphia being one of them. Detroit is probably the one, as you know, in the news, is our most vivid example of that right now. So we really thought, what would happen if we broke the cycle? If we sit here and interceded on this cycle of abandoned and vacant places, would this change something? And we found, well, I'll start by saying for the epidemiologists, we did some correlational work where we just looked at vacant properties and crime in the city of Philadelphia. And we found that there's a really strong correlation. In fact, locations of crime most highly correlated with vacant properties in the city of Philadelphia, more so than all other indicators, in fact. So poverty indicators, other economic indicators, education indicators, racial indicators, all these things didn't compare to the vacant spaces in terms of correlating. The question was, at the end of that study, though, what came first? I just showed you the cycle. So causality was very difficult to determine. Did the vacant spaces cause the crime, or did the crime crime precede the vacant spaces? Yeah, did it drive people out and then generate the vacant spaces, or was it vice versa? So we got together with a really great program that's a public-private venture in the city of Philadelphia between the municipal and the city government, the Office of Housing and Community Development, as well as the Pennsylvania Horticultural Society. Now, the Pennsylvania Horticultural Society is the oldest urban horticultural society in the U.S. They've been around for 150 years. They've been doing this quite a bit. And they have a number of programs. Probably the one that is best known is the largest flower show in the world. You're all welcome to come to Philadelphia and come to the flower show. It's wonderful in April. And in fact, the flower show is great because, well, this past year it didn't raise as much money as it was supposed to, but it has so many people come to it now that it offsets all the other PHS, the Horticultural Society programs, including this one, the Philadelphia LandCare Program. Okay? So the LandCare Program, however, is also a very large Horticultural Society PHS program. And what it does is it takes these abandoned spaces. You can see the before and after. It's an incredible visual shift. Okay? It's a very simple treatment of this space. And it has a couple aspects to it. So the space is cleared, yeah, which is no small task, but can be done relatively quickly, maybe in a week. Grass is planted, it's graded, and when I say cleared, many of these spaces have large abandoned items that need to be dug out of the ground. Could be furniture, could be appliances and so forth, many tires and this sort of thing. So it's graded and cleared, grass is planted, a few trees are planted. This is not an urban forestry initiative, yeah? And then, very importantly, a fence is put around that space. That fence is not like the fence you see on the left, which is falling down, that sort of hurricane fence, which is designed to keep people out. Yeah, the fence, and you can't see the openings in the fence on the right side, the after picture, but it has openings that are actually large enough, by definition, to get in a large lawnmower. Okay, but it also has multiple openings to encourage people to come into the space. You could jump the fence if you wanted to. Encourage people to come into the space and use it. Yeah? It's not designed to keep people out. So it's effectively creating a tiny little pocket park, a series of tiny little pocket parks in the city. Initially, when they started the fence, there was a lot of objection to it. Can anyone think why? So they really thought that people were just going to tear the fence down and use it for firewood or whatever else. And there was a lot of vandalism in the city. And in fact, there's been very, very little of that, perhaps because of what I'll show you, because people do become invested. They have become invested in the space and use it, and it becomes part of their daily environment. So there have been all the way ranging up, from kids using it. When we drive by these after they get green, perhaps in a month later there are toys and those giant awful plastic kid PlayStation things in it. But it's great because kids are now using it. People will begin to plant things and will take over some little portions of it, all ranging all the way up to barbecues and weddings. They've actually had a wedding or two on these spaces once they've been greened. And so it's a powerful treatment of this vacant space, and you can imagine if you have a dozen of these on a block, just like this, these are on average about 1,000 square feet. If you have a dozen of these and they're all done in 2 to 3 weeks, right? They're all treated. It's a massive change, visually at least, to that block. Again, in an overnight period. Now, when we began to look at this, the challenge here was, again, we wanted to get beyond just correlating this sort of environmental change and health outcomes. So we looked at before and after. We did what's called a difference in differences analysis over the 10-year period that they looked at it, that they had done the program. At that time, they had done 8 million square feet in the city of these little pieces of vacant lots. They had done 4,400 of them. We found, unfortunately, the city had, they had done 4,400. The city had 54,000 remaining across the city to choose from that had not been done. We randomly chose three lots that had not been done and matched them up with the lots that had been done. We looked at the before and after effects in both the greened and the control lots, okay, in all of these spaces. So they were good controls. The rule was they could have been greened. They were eligible and in the space to have been greened as part of that difference in difference. And the impact of the greening, when we looked at it out of 17 different outcomes, the impact mainly was twofold. The one major impact, and this was not something that we were expecting, but gun assaults went down. Now, there's a couple explanations for that. The one explanation is what you traditionally hear about in terms of a broken windows theory, that people become more invested in those spaces once they get greened. They're informally policing those spaces. And as evidence of that, not only did gun assaults go down, but as evidence of that broken windows investment, calls for disorder went up. Now, disorder calls here are typically noise complaints, perhaps public urination, other public nuisances, these sorts of things. Not violent crimes, but people were, and this is both, these are very significant increases or decreases as it may go, but people were really more invested in informally policing those spaces, we think. And when I first saw that disorderly call increase, I was very concerned, but my criminologist colleague said, well, of course, that's not because crime is going up, it's because people are now invested and they're making more calls to 911 and so forth. The second reason we think that this is so interesting, particularly for gun assaults, is because gun crimes went down, but it's not only because of broken windows, because people are more invested, but because these vacant lots are really great places to hide illegal guns, okay? People who participate in illegal markets can't just call the police when they have a business dispute. Yeah, they must have their weapons around, but they can't carry them on their person. Yeah, so they need to put them places. So they will frequently be put in these vacant lots and other places too, wheel wells of cars and so forth, to have access to them quickly, but also not to be, if they're ever caught with something else, that they don't have that gun with them. Other things, so the gun assault and the disorderly conduct calls were the big deal. But other things also went down. Those top ones occurred across the city. We studied citywide. Vandalism, also stress and inactivity went down in select sections of the city. We had some health measures that are suggestive. Again, stress and inactivity, that's exercising every 2 weeks or something like that. People exercised more, at least in one section of the city, after the lots had been greened. So field experiments in the Netherlands. So I wanted to break this down because our study was not a trial. Yeah. So there were issues with how completely balanced were the treated lots and the untreated lots. Were they the same in everything except the treatment? And we did a lot of regression modeling and statistical adjustment to try to get them as close as possible. But really the next step was to do an actual randomized trial.
Yeah, I'm curious in terms of sort of the epidemiology and how you got the data. Is it by block in terms of the gun assaults? By single address?
So there's a ton of details I'm leaving out to give you the two tops. But the ones I'm showing you that are statistically significant, we did it at 3 different levels of geography. One is sort of a weighted average, let's say for crimes around that particular point that represents the lot. So the clustering of lots per square mile around that point. Another way we did it was through block groups, which are like pockets of neighborhoods. So how many crimes occurred in the pocket of neighborhood that the lot was in. And the last was a tract, which is like the entire neighborhood itself. The statistically significant findings I'm showing you were statistically significant across all those metrics. And it addresses a few things in doing that. Well, just a lot of social scientists, for instance, epidemiologists as well, are tied to some particular geographic metric. I don't particularly adhere to that. I think you should try a bunch of different ones and see if they are showing the same thing, then you have much more confidence in what you're finding. But the other reason is that there was this concern that in doing this treatment that you were just pushing, for instance, crime around the corner. And with these increasing sizes, if you find, so for instance, a tract is a very large space. It's hard to say that it was just pushing it around the corner, and if you find a reduction in the larger space. So the Dutch have done these really great field experiments where it's this direct test of broken windows. This is the only one of its kind where they purposely graffitied parts of their cities. Now, to see what would happen and how people would respond to it. In this case, this is one particular experiment where they hung on everyone's bicycle. It's a huge bicycling country. On everyone's bicycle, they hung this little flyer that was like a nuisance flyer, and they wanted to see if they put graffiti up, what would happen to the flyers? Would people actually pocket them, put them in a trash can? What would happen? And in fact, when the graffiti was up, there was a much higher incidence of throwing it on the ground. And there were a number of other little experiments that they ran like this. And this led us to believe, well, gee, why don't we try to do this prospectively as an actual experiment going forward? But we knew the IRB would not approve of us generating blight in the city of Philadelphia to see what would happen to the residents. So we decided to go with a randomized trial using the same model that we did before, where we chose hundreds of lots that were randomly selected. Again, by the time this trial started last year, we still had about 40,000 lots in the city of Philadelphia. So we're choosing hundreds and hundreds of them randomly because we want a random selection across the city. And then we're randomly assigning 3 different treatment levels. The first is the full treatment, meaning cleaning, greening, and I'll say the third thing that's in this is maintenance. All these lots, someone returns every 2 to 3 weeks to mow the grass, prune the trees, pick up the trash, and so forth that comes into it. So that's all bundled in with the treatment. Okay? But the question was, is it really the greening? Yeah? Or is it the fact that people show up every 2 to 3 weeks to touch the space? So we had a second arm of the study that's just cleaning and maintenance, and then a third arm of lots that will eventually get a greening at the end of 2 years, but that will receive nothing over the course of the study. And it's been interesting, actually. We just finished this spring 300 or so. There's about 200 to 300 in each of those. arms of the trial. And it's been fascinating to see people's reaction to this. We have, in the city of Philadelphia, we have, the residents have a great distrust of city government. And so many of the neighborhoods where these random vacant lots have been really neglected for decades. And so you have a private organization coming in, the Horticultural Society, and their landscapers to do something, right? And, well, the anthropologists keep calling it the white knight syndrome. But so they will come in and do something, and it's the first semi-governmental interaction that the residents have had in a decade. And so they descend on the landscapers and begin asking, can you fix the potholes? Can you get my kid access to the Department of Human Services? All these sorts of things suddenly come into that. And we haven't actually dealt with that entirely yet. I mean, we say we're in there to do the cleaning and the greening for the neighborhood. And people are very excited about that, typically. But it's just an example of, is it really the greening, or is it the fact that folks are just showing up after decades of neglect? And so we've put the trial out to really try to get at that. And we have a ton of outcomes that we're looking at here, ranging from the people themselves. We'll be looking at all sorts of different outcomes of order, collective efficacy, people's fear of the neighborhood, people's trust of their neighbors, other social capital sorts of things, happiness, well-being, sleep. I don't know if that's going to have anything, but I've really taken a great interest in sleep skills lately, so they're really fascinating. Substance use, which is actually what's funding the study. I have to credit the NIH, the NIAAA, so we're very interested in alcohol abuse. And public drinking in particular, and how cleaning and greening a block might change that. Various mental health outcomes, and then physical health, exercise, and walking. And then there's many of the same environmental outcomes that we looked at before, particularly the crimes and nuisance crimes and illegal dumping and so forth. I'll also add, though, that we're doing these geographic analyses, these things called viewshed calculations, and I'll show you just briefly a few maps with those. And that is, we're going to be looking at people in the neighborhood, some of which live within view of the lots that are being greened from their home, and others do not, through these things called viewshed calculations. And it's going to be a side test of, do you need to be in view of the lots? Is that what's changing your health, per se? Being in that space. And we also have, this is entirely a mixed methods analysis, so we have anthropologists in who are in selective blocks, maybe a dozen select blocks, doing observations and following people in much more depth than we could epidemiologically at a higher level with different surveys. And then finally, I think a really valuable thing that we're doing is a cost-effectiveness analysis of all of this. What is the cost per crime averted? Should we find that they avert crimes? What is the cost per crime averted? And as I said, the program itself is very inexpensive to begin with. I was just talking to Jill Litt about this too. And so we have a preliminary study so the one we're doing right now is just doing the greening and interviewing people randomly selected around the lots, who live around the lots. We want to do another study, and we've piloted it on 30 people, where we walk people. So we make a change. This is a walk. This is a randomly selected walk in the neighborhood of Philadelphia. You see the red polygons in the middle. They change. It's not as green as it should be, but now they're green. What we found for these 30 people is a fascinating early biological finding. The within view, which is mostly the yellow walk, in view of the lots that changed, when you are within view, we're finding that your heart rate on the walk goes down by a very significant amount for those 30 people. In fact, it went down for every single one of them except one, and for many of them it went down quite a bit. That's compared to the rest of the walk where they're not within view of the change space, and in fact, they're probably within view. The other blue squares are abandoned lots that never got treated. Okay, so we really want to begin to look at some more biological outcomes here of exactly what's affecting people over the course of their interaction with these spaces. So who's been interested in Philadelphia LandCare Program? There's a lot of cities. Denver's not one of them, unfortunately. But if we can get you interested, it would be great. Phoenix and Los Angeles, which I think are not exactly like Denver, but are western cities, Houston as well, Kansas City, have taken an interest in it. We are really looking for replication. Milwaukee is probably the closest to thinking about replicating something like this at this point, but we'd like to find another city to maybe think about doing this.
Generally for community members here, if they want to get involved, how does that process?
Yeah, so usually I give this talk with my partner from the Horticultural Society who answers exactly that. But you can contact me. I'd be happy to put you in touch with the Pennsylvania Horticultural Society. The treatment, as I said, is a standard protocol. They go and have gone to all these different cities to give their dog and pony show, to do their driver rounds, and to show you exactly how the standard protocol gets implemented to do that vacant lot treatment. And they would be very pleased to come and do that.
Is there like a zero-scape version?
Wait, no, tell me what you mean.
Well, like, because in Colorado there's a huge, drought issue. They're just putting out a green lawn.
Yeah, and so this has been one of the issues. So Milwaukee has modified it slightly for their particular greening interests, which are different than Philadelphia's, and you all can think about doing that as well. I don't know exactly. You'd have different trees or different grass. I don't know the grass.
Yeah, like grasses,
so forth. Yeah.
Cactus, stuff like that.
Yeah, and so what they usually do is they don't just come in and tell you, particularly if it's not around the Philadelphia area, they don't just come in and tell you how to do it per se, but they want to partner with your different community development corporations that do this kind of greening, or landscapers that know that the particular environment in the city. I mean, LA was like that, and so was Phoenix. Yeah, there were a lot of questions in Phoenix about similar questions, like how do we do this in a desert environment?
Yeah, and I was wondering if like grass had something to do, with people's perceptions of that.
You mean the actual green?
Yeah, like with safety and warmth and I don't know.
Yeah, we've really, along with the visual part of it, now I don't know about grass per se, but we want to begin to look at the color green. And does the color green actually make a difference here as well? So I don't have an answer for you, but I think it's a good question.
Yeah.
So Charlie, in these other cities, and maybe you're getting to this, that have tried this, or are trying it, are they working with like cooperative extension? Are they working with botanical gardens, and what kinds of?
Typically something along those lines. It's usually a community gardening group. Some of the cities have very developed community gardening groups, are very far along, and already do something like this. I mean, most cities, especially Rust Belt and eastern cities, have some kind of vacant lot program. It just, there are a couple things that are absent, almost every one that I've seen, is A, that it's a catch-as-catch-can. It's not a formalized program that's within city government to respond to vacant and blighted lots. It doesn't have a fencing. None of them have fencing, which we think might be the active ingredient in this. And so there are these slight differences in the programs, and it just isn't as widespread as it was in the city of Philadelphia. And they will do it, as I said, because catch-as-catch-can. For our trial, I didn't say this before, but for our trial, we're doing it as part of their protocol. They want not to do like 1,000 square feet in isolation. They want to try to do either 5 1,000 square foot lots that are like sort of within view or on the same block at once, or some large 5,000, one single 5,000. So there's this desire not to do these in punctuated isolation around a city, to try to cluster them to the extent that you can. And other cities don't do that. They will do like one of them. And then I think the neighbors, actually that upsets neighbors. If there's a dozen of these on the block, someone is active about one of them, the city comes in and does one, and then the rest of them are left untended. So that might actually even be counter. It might be driving things in the other direction. So there's these other approaches to it. Yes?
What's the role of the property owner in the process?
Well, so there's two kinds of lots that qualify in the city of Philadelphia. So there are fully privately owned lots that the property owners are active and perhaps have fenced off or something like that, and that are clean, and those don't really get touched. Then there are city-owned lots. So about a quarter of the vacant lots in the city of Philadelphia are city-owned, and those can be done at any time in the city, so there's no actual property owner. The remaining 75% have a property owner, but we have a great ordinance in the city of Philadelphia that if it's deemed a nuisance and it's in violation, that you get, they call you and they send you a letter and you get 10 days. And if it's not, if you don't get a response and there's an objection by the property owner, then the city can come in and clean and green it. Now, almost never do they get a response because we're such an old city that those properties owners, like, they date to the 1850s or before that on the city records, or they've completely left town. They're in Miami or New York oftentimes, and they're just speculators who either have completely forgotten about their property or just don't care. And that's a problem. So the city should be able to come in and do something with that to do this minor treatment, which doesn't change, which, if anything, increases their property values. And I want to get to that really quick. So we've had, from our group, we've had 5 studies, 4 of which have been health-oriented, mixed method studies. The one I showed you is a quantitative study in the American Journal of Epidemiology, which you can look at. We've also had colleagues at Wharton and our business school that have looked at property values and sort of the economic impact of this. And what they find is that there's a significant increase, perhaps as high as 13% in property values in a 2-year period when you begin to do a large neighborhood of these sorts of greening infrastructures. Partly because and the original intent of this program was not for health and safety, was not to reduce crime and improve health, was that if a developer is driving around your neighborhood and it looks a little bit better, perhaps they would want to mass purchase these properties, and build on them, build residential housing on these properties. And in fact, about 5 to 10% of the properties that are in our study have actually gone that route. It's a lot less than what they originally wanted, but it still offers an opportunity for study. And I'll also say that we've had colleagues at Temple University also study it. That's one of these. And then we had visiting faculty from Japan that came in with the Horticultural Society and also studied it, all of which have found significant increases in certain things in terms of the vacant lots before and after. So this has been very interesting. What's been more interesting is the press coverage of this for all of these different studies. So a number of outlets have taken great interest in this, perhaps because it's readily understandable how this might work. And we've been posing more and learning more about how it does work. The City of Philadelphia is very proud of this because it's what the police commissioner has called soft policing for the City of Philadelphia. If it really is tied to something like an 8% reduction in crime, which is small, okay, that's small relative to the police commissioner taking 100 officers and placing them in a particular neighborhood, which might generate as much as a 40% reduction in crime. But then once the officers come out, we have good data on this, the crime just returns. Okay? The greening here has a much more sustained reduction in crime. It's lower, but it's much more sustained. And if it could be scaled up, perhaps it would even have a much larger impact. And that's partly why we're looking into this. Now, the one group that has taken a great interest in this is the federal government. Healthypeople.gov has looked into this, and that's one of the assistant secretaries of health, and they actually came out and did a tiny documentary. The bigger documentary is yet to happen. You didn't copy that, right? And I wanted to show you my little 5-minute spiel. Wait a minute. I will find it for you. And they were nice enough to come out and do a little documentary, and all they gave us thus far was the 4-minute version of the documentary. And it's taken us forever to get it because when you watch this, what would be interesting for you is all the trash, all the logos on the trash is blurred out. It took the federal government a year to blur out the logos because that's illegal. Let me see if I can get this to start. Now, do we have sound by any chance? No? Let me see. Let's see if I get sound on this and start from the beginning. Oh, you guys can kind of hear it. That's okay. Can you hear it okay?
If I had to describe the Philadelphia LandCare Program in 3 words, I'd say making things better.
The Philadelphia LandCare Program is a program initiated by
My traveling companion usually.
PHS, Pennsylvania Horticultural Society.
The city provides funding to PHS, and PHS carries out the program in partnership with the city.
There are 40,000 vacant lots in Philadelphia, and the Philadelphia LandCare Program manages about 7,000 parcels throughout the city.
This particular area is quite unique.
If you can envision this community over 20 years ago, it was acres and acres of blighted land, buildings vacant, high drug activity, high crime area.
You couldn't find a lot that wasn't filled with trash, weeds, abandoned cars. I mean, the things we found, bodies, drugs, guns, you name it. It was a hiding place and kind of defined the areas as what it was traditionally known as the Badlands.
When you clean and green these lots, make them safe places, get rid of the trash, get the community actively engaged and involved, not only does it improve the quality of life, but studies have now shown that it increases the value of property in the nearby area and has led to a reduction in crime and violence in those communities as well.
If you filled the space with something positive, like a garden, people wouldn't necessarily, do negative things, and it would really start changing the neighborhood.
In the green blocks, the reduction in crime, particularly for gun crimes, was much more precipitous than it was for the control lots.
Since the land is now wide open, everyone feels much safe and much happier than they had been previously to the demolishment of the building that was here. The idea that this program could enhance safety, could enhance health, was, for us, part of the package of how we look at things.
We believe that all of this has added to a lower domestic violence, a lower crime rate, and it has helped with persons with respiratory illnesses.
We've always had a broader view of what the impact of greening can be in the city and the community.
When you make the lots look better, it invites development. People can see this neighborhood in a different way and think, oh, I want to invest in this neighborhood. I want to develop in this neighborhood. This is my neighborhood and I want to support it.
The economic impact is great. A lot of people that are trying to start up businesses, which would otherwise not have the opportunity to do so, have been able to get a hold of grants and small, loans to start their businesses and have employed actually people, local people that live around here.
The program works because it is a community revitalization program that we work on together to make it successful in a neighborhood like this.
It's something that can be replicated elsewhere and potentially would have the same kind of impact.
You got a sense of some of the murals that were there as well. And one of the other things that was brought up is that the contractors, it's all local contractors, many of whom, for instance, have reintegrated folks from corrections and so forth into that. So it's also a jobs generator for those communities. So many people, when we go out for the trial right now, it's been really instructional for me, the lots that are part of the trial, to meet the folks on the landscape teams. And many of them are right, they're like, well, I live only 2 blocks over there, that sort of thing. So they're re-entering the neighborhoods that they were out of as part of a landscape team with a job. So that's also an added benefit here. So, and that's all I got. Thank you so much for the opportunity to talk about this and to tell you a little bit more about what we're doing in Philadelphia and our research. Do you have any more questions? The questions so far have been really great. Do you have any more questions you'd like to have?
Did you see, I don't know if you've done this analysis, but have you seen sort of a non-linear response, sort of to your point that there are areas where you might have multiple blocks that are eligible if you actually green multiple lots in one space? Do you see sort of more than the sum of these?
You mean like a dose response kind of thing? Yeah, and no, not yet. That's something we want to look at, and that's definitely on our list. And So for the epidemiologists, that's, we're trying to march down that road of causality. That would be great to show, and I don't know that that's the case. It does raise a question, though. We're beginning to look at, and our colleagues at Temple found this as a side analysis, that the greatest impact of the lots is not in the most absolutely challenged neighborhoods. There perhaps is a tipping point where a neighborhood is either completely, there's not challenge in the neighborhood, and the lots really aren't going to make a difference anyways, right? Because perhaps there's no crime or the health outcomes are already good. But there might be a tipping point in the other direction where a neighborhood has gone past a certain level of challenge where this remediation isn't enough. And we're going to begin to look into that as well. But it's sort of the in-between groups, and there's a large group of them, neighborhoods that are in between where this may have the greatest impact. The dose response is a great question, though.
I just had a question. You said that that one of the goals was to have some of these lots redeveloped.
Yes.
Residential properties. Have you seen with that 10% that was redeveloped, any of the neighborhoods not wanting the lot to be redeveloped because they've taken ownership of the fact that it's
Yeah. So right. So there are issues with, and that particularly manifests itself in terms of people don't want to pay higher property taxes. Yeah. People don't like gentrification, however you define that. Okay. In the prior American Journal of Epidemiology study, at the very end of our indicators is an additional indicator in property taxes. We did not find that property taxes went up by a significant amount. In fact, it's not significant, but they probably went down a little bit around this. So unclear why, and it could go either direction, but it's not changing the property tax structure, which was really helpful. I would say most people, most neighbors are very supportive of this when it comes into their neighborhood. There is a group that are not and are very suspect of it. And you have to imagine, some folks have lived in these neighborhoods for generations. They don't really care if you're raising their housing values because their intent was never to sell their house. And so we're trying to be as sensitive to that as possible with the program. Yes?
The question I had, because we've been doing similar things in Denver, very close to that.
Uh-huh.
But one of the things that we found out that from years of experience, the people were more interested in open space for their children,
Yeah.
so like neighborhood play areas.
Yeah.
Did you run across that?
We do, and what's happened is, so this program, the treatment doesn't generate a playground per se. There is a whole other program that does playgrounds. The issue with that is it's much more costly to put in playground equipment, to get Kaboom to come out or something along those lines. But what does happen with these spaces, I would say a non-trivial number of them, a lot of them, have, people will just bring in equipment for the kids, and it just stays there. And the thing to understand is, and I don't know if it's the case for Denver, but in Philadelphia, these are almost always right next to where somebody lived, right? So they're usually sandwiched in between two homes or something like that. In Philadelphia, we call it like a smile that's missing a tooth, right? And so the folks that live around that, particularly the kids, they will bring their kids out, and it's a big benefit for the kids who had nowhere to play before that. And in Philadelphia, when you let your kids go out and play, you don't want them playing on the block around the corner. You want them playing on your block where you have an eye on them or can hear them out your window. So to have an additional green space or 3 or 4 on your block, in the 2 or 3 week period, I would say, yeah, parents love it. And will basically take over those spaces with their kids and their toys.
Do you find that in those lots that have been green, do the residents tend to then kind of organize to develop on their own, maybe some of the remaining vacant lots in the area?
Sometimes. I would say it's more entrepreneurial than that. Like people personally take charge and will do things like plant flowers that the Horticultural Society didn't put in, or bring in toys. Sometimes people get organized around it, and it's one of the things that makes it different than a community garden or urban farming, for instance, where that sort of organized community involvement is necessary. Here it happens, and And the Horticultural Society, when possible, always brings in the block captain, and when it's an active block captain, which is a minority of the time, we'll get an organized community around it. But that's not a prereq to doing this. It's more like build it and they will come and perhaps organize. But
I was wondering whether you build it, they came and then they made more, kind of on their own.
Green more spaces? Oh, we do. Yes. We do have so-called guerrilla greening. It's a total tactical urban green. It's actually become a bit of a flashpoint in the city because, it works fine when it's well-intentioned people, but and again, you're right, and it's right next to the previously green PHS lots. We will have developers come in and secretly green stuff overnight to make it more attractive to something they just built. And there's been a bit of a backlash against that. But yes, there's been a decent amount of guerrilla greening. We had some students from the University of the Arts. So I'll say, people do get upset. If there's 12 of these on the block and you only have the money to do 11, people get upset about the one that you didn't do. And so we had a couple students from the University of the Arts who built these awesome seed bags, right? Particularly for ones you can't get access to. So maybe the last one is one that has a hurricane fence that's privately owned, that the owner just refuses to permit you in it. And so they had these bags of seed and like huge burlap bags that they would throw over the fence. And no, it's pretty neat. And if you throw enough of them over the fence, the carpet, this abandoned space, it grows and they put nice flowers in them. And it looks really pretty, much prettier than what it was at the end. And I would say many of those just go untouched. I mean, the owner objected, but then that owner lives in Miami. So, they don't really care what happens to that space. And that's unfortunate.
When you go into green place, how do you engage the community? Do you actually tell the people that are living near that this is going to be an open green space and we welcome your children and you into the space? I mean, how do you do the part that makes the community understand what you're doing and know how to use it?
Well, they touch the block captain first, who then will reach out to the community members, and then they do put flyers in homes. But it's basic. It's not an active community engagement program the way a community garden would be. Mm-hmm. Now, to the extent that people come out, and people come out once they see this, because it's a week of, it's a challenging week. All this construction here, right? So it's like construction. They'll bring augers in, they'll bring backhoes in, because they want to do this quickly and change this space visually. So people know at that point. And there's two reactions. One is, thank God the city's coming in to finally do something about these spaces. And I would say that's the overwhelming reaction of the neighbors. But then there is a reaction like we had a lady a couple weeks ago that was very upset because we cracked the sidewalk near one of these lots. Not we, but the Horticultural Society cracked the sidewalk. And so for the trial itself, so we had to deal with that. But I would say there's less community engagement, a formal community engagement. There's less of that than for something like a community garden. But in the end, the community does know about it, and the owners of the property certainly have an opportunity to object if they don't want it done. Yeah.
Where did you get your health outcomes data? Was it directly gathered, or did you use other?
For the prior non-trial study, it was through the city does, through the Philadelphia Health Management Corporation does a health survey every 2 years. Mm-hmm. And that health survey has data, de-identified data, but down to the level of the neighborhood. So we use that information. So it's not great.
And you're primarily gathering it now.
Correct. And so that's why that's one of the particular reasons that we're excited about the trial going forward, because we can have those 5 randomly selected people that live near each of the lots and interview them over the course of a year and a half, multiple times. And it's been an interesting system to try to. We have a great team of community members who do the interviews and go into the neighborhoods, and we've really established rapport and have a really great follow-up rate and response rate to that. So, yes.
Do you actively share the results of your analysis with community members, or do they just know that the positive things?
Well, the prior analysis was definitely shared. I mean, it was so heavily covered in the Inquirer, and we will bring that back out to folks for them to see it. Inquirer, the Daily News. There's a number. In fact, the Inquirer and Daily News have covered it, but many neighborhood newspapers have covered it, particularly then focusing on the few lot examples in their neighborhood that were greened. So people know about it now. So that's a research double-edged sword. So it's good to have people know about it, but then at some level we're going to have to start thinking about, are we testing the treatment itself or the treatment plus this sort of impromptu campaign to tell people about the greening. So that's why I come only to other cities to give this talk.
In the pilot study looking at the biological response
Yeah.
to disease, what measures are you looking at? Just look at like cortisol.
Yeah, totally. If you have recommendations, so we want to look at cortisol. The issue with it is that you can't walk people around with these crazy contraptions.
You could, but
Oh, God, nobody wants to do that. Like, I'll tell you, so I just found, someone just told me from Stanford that there's a respirometer that you can put on your hip now. So we had tried to have a respirometer with a band that goes around right here across people, and there was huge, people did not want to do that. Much less, we want to also have retina measurements. So this is really cool. So we have a guy in Wharton in marketing who studies what do people look at when they walk through a supermarket. And he puts these huge contraption retina measurement things on. He did this like 3 years ago. It's amazing for someone walking through the supermarket. What exactly are they looking at? We want to do that, and the huge contraption is now down to like the size of like Google Glass. So we want to try to do that as well to see, well, so they're walking down this space and their heart rate went down because they're in what geographically the GIS says is in the view shed, but are they really looking at the space, or do they not even care about it on their walk? So that's one thing. Cortisol will be another. If we can find a good way of measuring cortisol and taking specimen before and after, that also then translates into. I don't want to take specimen from folks without having a meaningful biological measurement, not something that's going to be all over the place. So, but that respiratory rate, heart rate, blood pressure, those sorts of things, vital signs we'll get into.
Do you see like the properties around these spaces with the property owners taking the initiative of improving their own properties, like in a viral effect?
Totally, and yes, we do see that. We haven't actually studied that yet, but that is sort of following up on that study from the Netherlands, which part of that I didn't show you is that when you put graffiti in a space, if you leave it go, more graffiti appears all around it. So you can hypothesize that it would go in the other direction as well. And that's a great question. So we do think people are more invested. They're certainly more invested in calling about nuisance crimes in and around the spaces. So I assume that might mean that they're visually also making their own spaces, their own homes and so forth, perhaps changing them and developing them, making them more appealing.
One more question? We're about out of time.
You mentioned Denver wasn't interested. I'm just curious about what does that process look like? Is it something that a government has to reach out to you, or
No.
you advertise it? I'm just wondering because we are in the city of Aurora. This campus is in the city of Aurora, and this very same neighborhood has many of the issues that you illustrated with the pictures. So Denver is not, but Aurora may. So
Totally.
How does that look like?
Well, no, you can reach out to me and I will put you in touch with the right people. The right people are usually, again, the private, it's not a government entity, the Horticultural Society, as well as the City of Philadelphia's Office of Housing and Community Development, which has supported it. But I would say it's mostly the private entity that will come out and show you exactly what they do. And you can start by looking at the website, which has the protocol listed out exactly how they do it. You can see much more information about it. It's interesting that you say that. We've had a couple of places that aren't major cities, exactly, that may be close to major cities and so forth. Brooklyn, right, which I guess is part of New York City, but has taken a great interest in this through their 596 acres program. I'm trying to think of the other group so Phoenix has been very interesting, and I think of that, and it's been unexpected. Phoenix is taking an interest in this mostly because of the mortgage crisis, and that so many homes in what are not urban spaces, at least the way I think of urban spaces in Philadelphia, but are very suburban, but have then suddenly a lot of abandonment on these blocks of otherwise well-off neighborhoods. So I don't know if that helps you, but that's exactly the kind of thing. You can reach out to me, and I'd be happy to put your community groups or the university in touch with it. And I will say the other thing, last thing I'll say, is the other thing is that it's been really valuable not only for us as a university to interact with our community groups on this, but this municipal community university partnership has been what's really carried this thing forward. And so hopefully you all can think about that as well. Thank you very much for all your questions and your time.